What made you become a doctor, Doctor Dr. Hannon?
I told you before, you didn't,
No, I
you
didn't.
want me to go over it again,
Yeah, just
huh?
again, I'm sorry.
Well, as I said before, it's I got out of college with a master's degree in chemistry. I couldn't get a job except driving a cab, and I had passed the examinations to go to medical school. So instead of driving a cab the rest of my life, I went to medical school.
What made you take the medical school exam?
Well, I took it on a bet. It cost $5 to take the exam, and there was a wealthy fellow in my class that he said I couldn't pass it, and he would pay the $5 if I would take it. So that's how I passed it.
But you couldn't go to medical school right away, is that right?
I went to medical school right after college, yeah.
Okay.
No, I drove the taxi cab in the afternoon during that summer.
And you started working in the pharmacy, right?
I know I had been working in the pharmacy for about 6 or 7 years. I was doing that after school. No, I had been working there for about 7 years, but as a clerk and assistant pharmacist and whatever that needed to be done. But that was in the apothecary shop.
What year did you graduate from medical school?
1937.
And when did you start practicing here in Worcester?
I'm not in Worcester.
I mean here in North Grafton.
In North Grafton, 1940.
1940. And what brought you here? Why did you start practicing here in Grafton?
Well, I was on a vacation, and this town was without a doctor, and I was on leave of absence from the United States Public Health Service. And no, I wasn't on leave of absence, I was on vacation. But I was scheduled to go on the U.S. Coast Guard Cutter Campbell to evacuate citizens out of Lisbon, Portugal. And I didn't want to go there, but I had to go. So, but when I found that this opportunity was open, I said, I'll stay here until they get somebody to take my place. I was going to stay here for 3 or 4 weeks or 3 or 4 months at the most. And I wired the Surgeon General Perrin, whom I knew, asking for a leave of absence, and he said, take your time. So they never called me back.
Wow.
So I've been here ever since.
And you were in general medicine, right? You never specialized in anything specific?
No.
And how come you didn't choose to specialize in anything?
I didn't want to.
Okay.
No, I don't like to be restricted to what you can do. No, when I started out in practice, we did obstetrics, we did gynecology, we did our own x-rays, we did our own minor surgery. All of this was done in the office. I've even done breast amputations in the office. But you don't do that now.
Yeah.
No, people come in now. You say you've got a head cold, so well, I better see a specialist. It's different.
So, do you want to talk about your days in the public health service? Maybe describe what that was like and share any stories you have?
My days in the
Public health service.
well, no, I think you're a little bit mixed up. United States Public Health Service runs the marine hospitals.
Yeah.
No, I was working as a doctor at the marine hospital. But I think you confuse public health service as doing public health work and the community and stuff like that. No,
Oh, okay.
no, it's they run the Marine Hospital, and the Marine Hospital takes care of the Coast Guard dependents and takes care of merchant seamen mainly, but they take care of other people if necessary, such as the Navy if it's called upon. But primarily they take care of merchant seamen.
And that's where you worked for a few years?
I was there for 2 years. I was in Hoffman Island, which is a small island outside of New York City. And there's a training base there. And they have, I think they had 20,000 recruits there in a small hospital. And I was chief medical officer, and we had 6 doctors and 6 dentists in a small hospital. And chief medical officer is the same thing as the superintendent in private life. So I was there for a year, and then I came here.
Okay. Could you describe a typical day of practicing medicine when you first came here in Grafton? What was a normal day like?
Well, we made house calls then, and we had to make a lot of house calls because during the war, people didn't have cars, and if they had cars, they couldn't get gasoline, so you had to make a lot of house calls. And I would usually start out at 7 o'clock in the morning and finished up around midnight. And,
House calls all day?
huh?
You made house calls all day?
Well, we kept office hours besides that. I had office hours in the afternoon, office hours at night to make house calls in between time. And at one time, I made 46 house calls in one day.
Wow.
But that keeps you going. But I started at 6 in the morning, I got through at midnight.
Was this during the Depression when you said that doctors only got paid 50 cents a house call?
No, that's when well, yes, there was, it wasn't like the big depression in the 30s, no, it wasn't like that, but there was a depression, probably 37, 38, 39, around there, and people just didn't have any money, and they were, and the threat of war and things like that, things changed as people just didn't have money. So it was very common, not in this area, but very common in Boston for doctors to make house calls for 50 cents. And we had one doctor in town here that's making house calls for 50 cents.
So did you spend half your day in the office and half your day making house calls? Would you say that's about what you did? What were your hours?
Well, just, I would say probably about half and half, because in the afternoon you're probably in the office 3 or 4 hours, at night a couple hours. So, and not every doctor in those days had office hours in the evening. You don't do it now. But yeah, every doctor had office hours in the afternoon and had evening office hours. Usually took off on Wednesday and took off Saturday night, and a lot of doctors had office hours on Sunday and Sunday morning.
What time did you stop working in a day? What were your hours like? What time did you start in the morning, and what time did you stop practicing at night?
Well, as I told you, I started usually about 7 o'clock, and then I worked until I got through, and you would have people, before we had television and all, people would go to the movies. They'd go to the movies and stop back after the movies to the office because at 10 o'clock at night. So
you could be working all day.
Yeah, so you're working all the time.
So what do you think it was like for your family to have a doctor working all day in the household?
I don't know. I never asked them.
Do you know what they thought of having a doctor in the household just in case?
No.
Okay. Did you ever take vacations?
Well, I took a vacation in '46 when the war was over. Took a vacation. And after the war was over, yes, I took vacations up until 1979. I took a vacation every year, and usually outside of the country.
Okay.
I would go to Europe, South America, around the world. And no, I did that up in '79. Then my wife got sick, and I was confined then to whenever I wasn't working, I had to be with her because my housekeepers wanted time off too.
You told me about how you got trapped in Russian territory in Germany. Was that during one of your vacations?
You know, yeah, it was. God, I don't know. I had that because I told you that they interviewed me here 3 or 4 weeks ago, and they wanted all this stuff, and I had it, but I think I took it home. Probably 1950. I'm not sure. It was. I don't know how long the Berlin. Of course, Berlin was divided when they put the big wall up. I was there before they put the wall up. And I was staying in the American zone. I took a train. I thought I was going into the British zone. And I took the wrong train, so I ended up in the Russian zone. And I got out. All the buildings were bombed out, and also I hid 3 days in rubbish and stuff like that until, as I told you before, I got on the train. Do you want me to repeat that, or is it on there already?
Yeah, you just repeat a little bit of it.
Well, I got to a subway station and took all the German money I had and threw it in the window at the woman and grabbed the ticket taker, and she started yelling at me. I got on the train, and the soldiers came through checking people's papers, and I pretended I had to go to the bathroom, so they let me go. They didn't look at my papers, which I didn't have any.
Yeah.
And I stayed there until I got back into the American zone.
Well, let's get back to your medical practice. Did you ever use a telephone to talk with patients? You must have, right? Did you use it frequently to talk with patients?
Did I ever do what?
Use the telephone to talk with patients. How frequently did you talk with patients on the telephone?
Well, I always answer the telephone and talk to the patients. Is that what you mean?
Yeah. Did you? So you talk with them a lot? Did you use the telephone frequently to talk with patients?
Well, I didn't keep track of it. Of course, if anybody called, I talked with them until they were satisfied as to what they were calling about.
Okay. So you never went to the hospital to see patients or anything, right? Did you ever work at the hospital, at any hospital?
During the war, I did some work at St. Vincent's Hospital, in the old hospital.
Yeah.
Not the one you think that is old. No.
Not on Vernon Hill?
Huh?
Not on Vernon Hill?
No, no. The old hospital was an old brick building there, and I think they turned it into a dormitory for nuns or something.
Okay.
That was the original St. Vincent's Hospital. Yeah.
So what were your rounds like at that hospital?
Well, ordinarily I would turn patients over to somebody that was in that specialty, and I would go there whenever I could. So no, there wasn't any set schedule.
Okay. How many patients would you see on average over the course of one day, do you think? How many?
What was the question?
How many patients do you think you would see in one day, on average?
I kept track of it, 29.
29. And most of them lived around here in Grafton?
Most of them did, yes, but I had patients, I have even had patients from out west, but they would have relatives here, and they, for some reason or other, they would come here.
So what did you really like about your practice? Why did you keep being a doctor once you started practicing?
Well, I liked helping people, and that it didn't make any difference whether it was in medicine or working in a grocery store, the clerk or whatever. I've always done that. When I was, I don't know, probably 15 or 16 years old, I worked in what was at that time known as a Quaker Maid store. And the Quaker Maid store was bought out by the AMP stores, Atlantic and Pacific. But I worked there waiting on people and in a grocery store as a clerk. No, I've always enjoyed helping people. But no, I like helping people. But as far as medicine is concerned, that's probably my main motive, is to help people, but I would never go into it again. Never.
If you had the chance to go into chemistry, you would have?
Huh?
If you had the chance to work in that chemical plant, you would have taken the job?
Well, I would probably find something to do, but medicine is too restricted now. Everybody comes in. I've had people come. I had a woman just a couple of weeks ago that she had a sinus condition, and after that she was hoarse. She wanted me to make arrangements for her to have an MRI. I said, for what? She said, oh, my vocal cords. I said, but so you get, the people are telling you what to do now, and you feel like saying, if you're going to pay for it, would you still want it? So they're not paying for it, so they want everything. No, I've always kept laboratory work down, x-rays down, and medicine down as cheaply as possible, and only do things if it's essential. But to everybody come in and have a chest x-ray, everybody come in and have electrocardiogram, that's ridiculous. Because it just runs up bills for everybody else. The people may not have to pay, but you have to pay eventually to increase premiums. So, I wouldn't want it, because people think that they have been well educated in medicine through television and the newspapers and things like that, so they think they should tell you what to do. And come in a couple of weeks ago, there's a fellow here that had a small hernia, and he wanted to make arrangements for him to have a colonoscopy. He said, something wrong with my bowels. I said, no, you have a hernia. No, he said, because every now and then when I pass gas, I feel better. I said, well, everybody does. So, no, I would never go into it again.
So instead of asking you for advice, your patients want you to get them an MRI?
Yeah, and you go along with it if it's reasonable, but if it's unreasonable, they say, no, if you want that type of service, go someplace else. Because on prescriptions and things, I try to order the cheapest thing that I can and order for the condition. If it doesn't work, then you can order the expensive things. Some of these drugs that you see advertised on television for hay fever cost something like $300 for a supply. Would you believe that?
Yeah.
That's a lot of money. A lot of money, but they say, well, my insurance will pay for it. That's a lot of crap.
So what were the most typical illnesses that you saw in the 40s and 50s?
What was the most difficult cases I have seen?
Yeah, that you saw early in your career. The most typical illnesses.
I don't know. No, I never found any of them difficult.
No, typical. Like.
Oh, I thought you said difficult.
Oh, sorry, typical.
Oh, what was... Well, I suppose with every doctor, the most typical things that they have to see are respiratory illnesses, head colds and coughs and bronchitis and things like that. I would say I never figured it out, but I would say that, and probably next to that, stomach complaints of inflamed stomach or heartburn, things like that. But no, I think respiratory things are probably the most common.
So that's what you usually treated when you were back in the 40s and 50s?
I'm in general practice. I see everything. I've seen everything.
What else did you see?
Huh?
What else did you see?
I saw everything that's been imaginable. I've seen. I haven't seen tularemia. I saw that when I was in Kentucky, but I haven't seen that around here. Do you know what tularemia is? No. It's a rat bite fever. No, yeah, rabbit, not rat. Rabbit fever. No, I've seen just about everything. I've seen brain tumors, polios, everything.
And so were any of them very difficult for you to treat?
Difficult for me to see, or difficult for me to diagnose?
To treat or diagnose, or just any particular ones that you didn't really like seeing.
No, I can't say so.
What do you think was the most important breakthrough in disease treatment during the course of your career?
What'd you say?
What do you think was the most important breakthrough in disease treatment during the course of your career?
Well, the antibiotics. Penicillin was just coming out when I started in practice.
Right.
Yeah.
How about in disease prevention?
How long what?
Prevention. What about in disease prevention? What was an important breakthrough?
Your disease prevention begins in babyhood when you give the injections for diphtheria and those diseases. Your childhood or baby inoculations. That's your prevention.
What was the worst epidemic that you can recall?
The polio epidemic we had in, I don't know, around 1950, I think it was. That was probably the worst one we've had. We had probably 25, 30 years ago, we had a bad influenza epidemic here. But it was throughout the entire country at that time. But we had a polio epidemic, and I saw 3 cases in 1 week. I didn't see any before that, I didn't see any after that. But it was quite rampant. That was before we had vaccines for it.
Could you describe attitudes towards smoking and cancer throughout your career?
Could I what?
Describe attitudes towards smoking and cancer throughout your career in medicine. The general attitude of people and yourself.
The general attitude toward people with tobacco is they'll do as they damn please. And you can talk to them. I gave up, but I tell them, you've got bronchitis, you've got emphysema, you shouldn't smoke. I tell them once, that's all. I never tell them after that, because you have told them that they know what the score is, And if they want to continue, that's up to them. So if every time they come in they say, "Are you still smoking? You still smoking?" You should stop. That's nagging. That's not doing any good.
How has your attitude changed? Have you always been against smoking?
Yeah. When I first, well, not because of the lung disease, but because when I first came here, you saw the waiting room. The first week I had to have all that furniture redone. They would take a cigarette and they put it on the arm of the chair and leave it there, and would burn a hole into it, or burn the thing off. Or they would take their cigarettes and put it in a magazine and close the magazine on top of it. So I had to have the whole damn thing done. So I had a sign put up there the first week I was here, no smoking. People are ridiculous. And I had smoking trays out there, you know, the stand-up things, you know, for, I had them, no.
They still didn't use it?
No, hell no. Why would they put a cigarette on the arm of a chair and let it burn through? Well, anyway, but no, I've been against cigarette smoking because I never liked it. I tried it once. I bought a pack of cigarettes when I was in college. I smoked 2 of them. I didn't like it. I never smoked it after that.
In technology, in medical technology, what is something that doctors take for granted nowadays that you didn't have in your career in the early part?
Well, they take for granted these MRIs, and these things now is something that we've always had. Of course, we haven't. We've only had it for the last few years.
Right. You had x-rays, right?
You know, I did my own x-rays, yeah. I didn't do GI series and those, but I did chest x-rays, heart x-rays, and x-rays for possibility of fractures of the wrist or the things like that. No, most doctors in those days had their own x-ray equipment.
Could you describe that equipment that you used? Describe the x-ray that you used in the early part of your career.
There's an x-ray machine. What else?
Okay. Because they've changed, obviously.
I still have it. I don't use it, but I still have it. You can look at it before you leave if you want to.
So you feel that doctors take for granted all the new radiological advances, the MRIs, the CAT scans?
Yeah.
Anything else? Anything in any other field?
Unfortunately, most of your modern doctors based all their diagnosis on laboratory work and on other procedures rather than on a complete examination of the patient and listening to the patient, because if you listen to the patient long enough, they're very often will tell you what's wrong with them. But most of them won't. They won't listen to the patient. They look at the patient and say, "What's bothering you?" Okay, we'll send you down to the laboratory. We'll send you to the X-ray. So they base everything on laboratory work and other things rather than on what they were trained to do. You were trained to do complete examinations and make your diagnosis from that.
So what technology is still in use that you use frequently in your career? What technology is still in use in medicine today that you used in the early part of your career?
What is still in use?
Yeah, that you used.
It's a telephone. Well, a microscope, I suppose, is the same thing. They're still using it, yeah.
Would you like to take a few minutes to show us some of the equipment that you have here? Maybe, do you have any old equipment? Before we move on to that stuff, could you just mention where you went to medical school, Dr. Hannon?
University of Louisville.
Okay. Alright, would you like to show some of the equipment that you use, or used, or still do?
Well, this is for measuring the woman's pelvis. On obviously a pregnant woman, so you know how large the pelvis is, so that you can adjust for it during her delivery. This is a guillotine for taking out tonsils. These are forceps for helping to deliver a baby. The head goes in here. This is one of the type of probes that you use for opening up a stricture in a woman or man's bladder. And it doesn't hurt, but it's but this is a small one. I have one that is about 4 times as large. I remember I had to use it on a man, and he was after I was through with that, I went to the sink to wash off the instrument and wash my hands, and he got off the table, and he looked over my shoulder. He said, "What's that?" And I said, "Oh, this is it, I guess." I said, "This is what I put up your bladder." He said, "What?" I said, "This, I put up your bladder." The guy fainted just looking at it. It was all over. But that, if you really think about it, the average stream of urine is as big around as this. But people look at this and they think it's something's awful. So this is just ordinary. This is for, of course, shaving the woman. And oh, now this is my prize. This I'm very proud of. The other stuff anybody can do. In the home, you're usually working alone. You may have the woman's mother or somebody there, but you don't know what the hell she's doing. So the women, they groan and grunt, and you think that they were having an awful bad time. But you couldn't, in those days, you got for taking care of the woman for up until the delivering the woman and taking care of her and the baby for the next year, $35. So you couldn't very well hire somebody to give the woman anesthesia. So with this, you fill this with chloroform. You fill this with chloroform, you give it to the woman, she puts it up her nose, she inhales it until the pain goes away or she goes to sleep. She can't get an overdose because as soon as she goes to sleep, her hand falls away.
Yep.
Isn't that clever?
That is clever.
Yeah. So this goes up the nostrils. I'm very, very proud of that. I had a woman that I used this on years ago, and she's my age, but she's still alive. She offered me $1,000 for this once, but I don't know whether it's still in. But isn't that clever?
Yeah. No wonder it's your pride and joy. No wonder it's your pride and joy. It must have made your job a lot easier.
Yeah. So I guess that's about all the stuff that's in here to amount to anything.
Is that about it in this whole office, you think?
Huh?
Is that it in this whole office? I mean, is that the oldest equipment that you have, you think?
Is this what?
The oldest equipment that you have?
Well, this is the equipment I started out with, so it's probably the oldest I have.
Okay, so we can move on now.
What?
So we should probably move on now and start talking more about this stuff. Did you have access to the new technology in medicine as it came around?
Did I have access to what new
The new medical technology,
such as what?
Such as the radiological devices, like MRI, CAT scans, new X-rays.
No, the only thing that we had when I was in school is X-rays. Of course, they came out in 1910 or something like that. So you had your X-rays in your laboratory. That's about it.
So what do you think is the most important invention in medicine that you've seen during the course of your lifetime?
Well, your MRI is probably the most advanced thing at the present time. But it has its uses. I think it's overused. I think the doctors should spend more time with their patients to try to make a diagnosis before they go through these expensive things.
What would you like to see invented in medicine? Is there a piece of technology that you would like to see invented in the future?
No. I would like to see them invent more constable, maybe, or something like that. The doctors were, I don't know what the term would be, but anyway, they should be more responsive to their patients.
Okay. What were some of the most important drugs in your practice?
Most important what?
Drugs that you used in your practice.
The present time?
No, earlier in your career. In the 40s and then the 50s.
Well, the same as now, because the antibiotics were coming out in the 40s.
Okay.
You know, of course, we still have antibiotics, and a lot of newer ones coming out, but they are much more expensive than the older ones, the penicillin and ampicillin. Those things are relatively inexpensive. A week's supply of ampicillin probably could run about $10. Well, if you get one of the more expensive ones, it could run you $200 or $300.
Were there any drugs that you used that aren't still in use today, that are not used anymore?
Well, there are a lot of drugs that were used in the old days that aren't used now, like asafoetidine.
Okay.
I can't name them all right off, but would you like to see the drug book that we had when I was in school?
Sure.
This you wouldn't believe.
So what drugs were frequently used by you from that book?
I'll look. I don't think there's anything in here that I used. They have belladonna here, and that is still being used in the drug with for stomach, an antispasmodic. That is still being used, but is they have calamine lotion in here that is still being used for poison ivy. And in the old days, when I was in the apothecary shop, we had a ointment that was made up from red pepper and was called I've forgotten the name of it now. But recently, 2 or 3 years ago, companies started making it again for rubbing on arthritis and stuff. And it's so it's back on the market. And I see that it's in here. It's capsicum. It's made of cayenne red pepper. They used it in those days in a weak mixture for stomach problems and an ointment for rubbing on for arthritis. And they have cascara in here, which is a laxative. Some people use that now, but I don't think it's even on the market anymore. And they have iron sulfate here, which is still our mainstay for treating secondary anemia.
That's about it?
Huh?
You just want to move on now?
Yeah.
All right. That was good. So, well now, do you think that everyone who needed care received it early in your career?
Do I think what?
That everyone who needed health care received it early on in your career? How did people without money get health care?
Well, we've always had welfare in this state. Of course, I guess every state had it. You mean, how did people that weren't on welfare and didn't have any money, how were they taken care of?
Yeah.
Well, I have never turned down anybody because of money. I've never anybody that came here, I never asked them if they had insurance. I never asked them if they had anything. Of course, and when I started out, you didn't have these insurance plans. Blue Cross and Blue Shield came out about 1945 or something like that. So you didn't have these things. But no, when people come in, I take care of them, and if they pay, they pay. If they don't pay, I send them a bill. If they don't pay that, well, so I've never turned down anybody because of pay. I've turned down a few people that have cheated me. I've had people that would have insurance coverage or something like that, and I'd take care of them, and the insurance company would pick up the bill and give them the money, and then they would keep it. That's dishonest, so I wouldn't take care of anybody that would. So that's happened a few times. But the majority of people, and at the present time, I still take care of welfare patients, but it's been 3 years since welfare has paid me anything. But I don't tell the patients that they're not being paid. I don't want to embarrass them because it's not their fault, but it's the economy, I guess, of the whole state.
What were some fears and concerns about socialized medicine in the 1950s and the 1960s?
What'd you say?
what were some fears and concerns about socialized medicine?
Well, it depends upon the country. You mean in this country?
Yeah.
I don't know. Socialized medicine has some good aspects, but it has some bad aspects too.
Like what?
One of my trips to Europe was for the Massachusetts Medical Society. They didn't sponsor it, but they asked me while I was there to look into socialized medicine in England. I visited one doctor, and he had a 3-minute egg timer on his desk. And he said, "See that?" And I said, "Yes." "What's it for?" He said, "When a patient comes in, I turn it over. 3 minutes, they're out. Whether I know what's wrong with them or whether they've had them anything and all, they get out." So that was in socialized medicine. I saw another one. He was in a small town outside of London. He had his office in, looked like an old store, but he lived upstairs over it. So I said, "What happens if somebody wants you at night?" He said, "I open up the window and say, 'You get away from here, I'll call the police. Go someplace else.'" I ran into a woman in my travels, I guess I ran into her in Paris, but she lived in Birmingham, England, and I had letters from her. One letter I had from her was that she was an old maid and she lived with her parents. Her father had fallen down and hit his head on a radiator and was bleeding. They called the ambulance, and the ambulance didn't show up. He kept calling, the ambulance didn't show up. The man died. And in those days, pretty much like we used to have here, people were buried from their home. The man was being buried from his home. As they were carrying the casket out, the ambulance showed up. So these are the disadvantages of socialized medicine. Socialized medicine, the way they do it in Canada, apparently it saves people some money, but they have to wait a long time. I've known people, relatives of patients of mine that would need a gallbladder operation, for instance, they would wait for 2 years. Things like this, so I don't know. What we have now isn't the greatest. But whether socialized medicine is any better or not, I don't know.
Were physicians ever involved politically on the topic of socialized medicine? Were physicians involved politically on the topic of socialized medicine?
Were they involved in England, you mean?
No, over here in the United States.
Are the physicians involved in socialized medicine here?
Yeah, politically, were they?
Not that I know of.
As managed care came into healthcare with Medicare and Medicaid and HMOs, how have you seen physicians and patients and people's access to care each be affected?
What?
How have you seen physicians and patients and people's access to care each be affected by managed care, by Medicaid, Medicare, and HMOs?
Well, as far as I know, people that need care get care, regardless of whether it's HMO or whatever it is. But the HMOs that we have around here is very apt to put people off for a period of time, even though the people think it's necessary. I've had people with, I remember one woman had a child with a high fever, and it was on a Saturday, and I had office hours on Saturday in those days. And she tried to get into a Fallon clinic to have the child examined, and they would give her an appointment, but 2 weeks later. So those things do happen, but how often it happens, I don't know. But it shouldn't happen at all.
Do you have any other thoughts on the subject of managed care?
Do I have what?
Any further thoughts on managed care, on the government and medicine?
No, I don't know. I don't know whether the government getting involved in this makes much difference.
How much did it cost for you to go to medical school?
Well, in those days, you didn't have dormitories for the students to live in. No, so I lived at home. And the tuition in medical school was very cheap compared to that day. It was either $400 or $500 a year.
Did the cost of medical school influence where or how you practiced medicine at first?
No, it was just a cop-out instead of driving a taxi cab.
Did you know any other physicians at that time who were affected by the cost of medical school?
What is your question is?
Did you know any medical students at the time when you went to medical school who were affected in where or how they practiced medicine at first by the cost of medical school?
You mean, did the $400 or $500 keep them out of school? Is that what you're talking about?
Yeah, or affect how they practiced medicine after they graduated?
I don't know. I don't know what they did after they went.
How do you think school costs today influence the choices of young doctors?
How do I think what?
The medical school costs today influence the choices of young doctors?
I don't know. I don't know how it influences them. Most of them want to specialize, and maybe they should, because especially in Massachusetts or in this part of Massachusetts, there's no room for a family doctor. There's no possible room, because as I told you, the people, they come in, they want to tell you what's going on. And it's not like when I started out, you did obstetrics, you did minor surgery, you did everything. But when I started out, the emergency rooms were almost unheard of. I did all the emergency work here, and I did the emergency work for the state police. I even had blue lights on my car. So that has gone by, but any highway accidents or anything, I had to go on them, because to pick up somebody and send them in an emergency room, people just didn't do it.
How have doctors' salaries changed over the course of your practice?
What?
How have doctors' salaries changed over the course of your practice?
Have their salaries changed?
Yeah, for doctors.
I don't know what the doctors' salaries are. I haven't any idea. Most doctors don't work on salary. If you work for a clinic, of course, you're on salary, I think. I don't know. But most doctors in my position, they're on a fee business.
So most of your income came directly from your patients throughout your career, right? You had a fixed amount that you charged for each visit?
Yeah.
How much did you charge for the average office visit?
How much is it now?
No, how much did you charge for an office visit back then?
When?
Early in your career.
Well, I told you before, it was $2. When I started out, is that what you mean?
Yeah.
Yeah, it was $2. And $3 for a house call.
How has malpractice insurance changed over the years?
It's more expensive. Malpractice insurance, when I started out, was I think $400. Now it's around $6,000, which compared to some of the specialties is quite reasonable.
And how do you think its impact on doctors' practices has changed?
With the malpractice?
Yeah.
Well, I know doctors that have retired because they couldn't afford the malpractice insurance.
How did you learn the business of medicine?
How did I learn the business of medicine? That's a strange question. Medicine isn't a business to begin with.
The business aspect of medicine, of charging your patients and...
No, you mean the fee schedule?
Yeah. The business part of medicine, you know?
I don't see what you're getting at. The business side of medicine is a fee per visit, and that has to pretty much be the same throughout your neighboring communities.
Okay.
But to say it's the business side of medicine, I don't know. I don't know what you're talking. I know there are things like in every business that you tender your business or you lose it. And I have, since I've been here, there have been 29 doctors moved into this area. And they all think because they have a damn MD degree that the world owes them a living. And they think they put up a sign, I'm a doctor, and people are going to flock to them. So they think they can work 2 or 3 hours a day and make a living. You can't do it. You couldn't do it in anything. You couldn't do it, work over the street or anything. No, but no, there have been 29 doctors that have been here since I came. There's only one of them still here. But it's because they don't want to work. It isn't because they're not qualified. It's just that they're lazy.
What are some changes that you've seen in the demographics of this community?
The change I've seen in what?
The demographics of this community.
I don't know what you mean by demographic. That's it.
The population. The people.
Well, the whole town has changed. Most towns around large cities have changed. I think most of the people in this area now are more or less, this is a bedroom town where people work in other cities. No, the old timers that were here, they've all died off.
What changes have you seen in women's health?
In women's health, well, they have better means of diagnosing breast cancer. I don't see anything any more than that. There are some new drugs that are supposed to prevent osteoporosis, but that's still questionable.
How about in children's health? What changes have you seen there?
In what?
Children's health.
Children's health? I stopped seeing children about 20, 30 years ago. I think the children are healthier now, but I think that they're being pampered too much, too. I think that The parents, particularly the well-to-do parents, they do too much for the children, and rather than let the children get out and make some of their own decisions.
Were there were there physicians that you admired when you started practicing around here?
Were there what?
Physicians that you admired, that you looked up to?
Oh yeah, there have been a couple, but not many. Not many. Been a couple, but not many. Maybe even your high-class specialties, I've caught them cheating. And it's too bad. One of the chief doctors at one of the hospitals here, he's now retired. When Medicare was allowing $10 for a office visit, he was charging $40, but he would only give the patient a receipt for $10. In those days, when Medicare first came out, the patient could pay for their visit, get a receipt, and then get reimbursed. But I guess there were too many doctors screwing around the way this guy did. So then they finally made it that you couldn't take money from a Medicare patient. You had to send it in, it had to be processed, then they would tell you what you could collect. If you try to collect any more, you could get indicted. But that son of a bitch, I see him around every now and then. I think, what a crook.
One last question. What advice do you have for younger doctors?
What?
What advice do you have for younger doctors?
Pretty much as I've already told you, listen to the patient, examine the patient, spend time with the patient, spend hours with them if you need to. If you can make a diagnosis and you're sure of it in 5 minutes, good. But if you can't make it, stick with the patient until you can. Yeah.
Well, that's it for our interview. Thank you very much, Dr. Harland.
I'm glad that you're